Thank you. Thank you, Scotch. I have a few disclaimers. First of all, there will be no RWJF funding used in any betting. So you can't use your grant to place a bet on a horse. My personal jockey favorites will probably be, Jockey Simpson and Jockey Monroe, who are going to be presenting tomorrow. I have two amazing opportunities here. Well, several, but I'll just name the first two, and that is I get to launch something new for the field of public health service and systems research. Something that's not just new, but is really groundbreaking, will, I think, set the stage for the future of this field, and which many of us had no idea 8 years ago that we could ever aspire to be at this place. So the first thing I want to do is draw your attention to the screens and show you that right now, live, we have the first issue of an online journal called Frontiers in Public Health Services and Systems Research. This online journal, which was developed under the leadership of Dr. Glenn Mays and Dr. Scutchfield, is the first online launch of a PHSSR journal that is peer-reviewed and modeled after some excellent examples such as the journals and issues of MWWR. This journal, it provides a platform to share and disseminate research where it makes a difference, and that is in the community, in the hands of the community, in the hands of practitioners. So I'm just so very delighted to point to this as a clear victory for the field of public health services and systems research. So let's hear it for Frontiers. So as Scutch has mentioned, I'm going to be moving on to do other things, but PHSSR will always remain in my heart. I honestly didn't know what PHSSR was before I met Scutch and then Glenn. I'm a health services researcher by training, and most of my research has been looking at the kind of relationship between social determinants and healthcare access. But when I came upon this field, I met some incredible people, and I have so many folks to thank for contributing to making this field and this conference what it is today. So my first thanks go obviously to the Center for Public Health Services and Systems Research at UK. There are so many individuals who come through the doors of UK not really understanding or knowing what PHSSR is, but committing a career and a research to that field. So folks like Rachel and Charla and a part of the PBRNs, Doris, Anna, Becky, Cara, Melody, Christina, Rick, Elizabeth J, of course Cynthia, who's been really the backbone of the center for administratively and as a thought leader for so many years. And of course Paul Irwin, who's partner in crime with Scutch and Glenn Mays, and of course Scutch. I'll say more about him in a few minutes, but I also want to thank all of the advisory committee members. We have a meeting here concurrently yesterday. We had the advisory committees for the PBRNs, Ross Bronson, Paul Irwin, Bobby Pestrunk, Alice Ammerman, Pat Sweeney, and others who joined us on the phone. The PBRNs is, I think, a great accomplishment of this field in terms of making sure that whatever research is done has relevance to practice. Also convening were the PHSSR National Coordinating Center Advisory Committee, led by Carol Moeller as chair, with Carmen Navarez, Eduardo Samoes, Julia Costas, Judy Monroe, of course, Les Beisch, Bill Keck, and others. I'm going to talk about the second great achievement in a minute, but I also want to acknowledge folks who at CDC who worked along with Judy, like Tim Van Wave and Myron and Stacy Madison, who worked so hard on the agenda. I know almost everybody in this room. That is a rare occurrence when you work in research. And it says something unique about this particular field, I think. I'm not going to say everybody's name, but consider yourself thanked for your work. We have folks here who are working on the annual solicitation for PHSSR and NPHI, the National Network of Public Health Institute, Joe Kimball. Dr. Nikki Lawhorn, is Dr. Lawhorn in the house? Nikki just got her PhD. This is the first time we get to call her doctor, so please call her doctor when you have a chance. We also have Lizanne Brown from NPHI. And among us, we are all to thank our blessings for having Lisa Simpson at Academy Health. I mean, I can't think of a better advocate for public health than Lisa Simpson. Last year, she spoke to you as the plenary under several medication and drug-induced. She hurt her foot, but she was determined to be here, and she was here via Skype, and now we see her in the flesh. And she drove an hour and a half from Cincinnati and a lot of other travesties along the way. But, you know, Lisa is a physician by training and has a commitment to maternal child health. And she has been working fiercely to make sure that folks in Academy Health embrace public health. And it's one of their 4 goals for the board this year. So please make sure you have a chance to talk to her about all the great work they're doing. Of course, none of this work is relevant if not for the practice community, and that means organizations like NACHO. And Bobby, I don't know if Bobby's in the room, but Bobby, here he is, Bobby. Who cannot see Bobby with his bow tie? That's Bobby. You know, Bobby took on this role, not a small task, to really make sure that everything that we did in PHSR was relevant to the people that he represented. I mean, he was one of those practitioners in Genesee County in Washington, and was a model, I think, leader for local public health. And now he's helping us with Carolyn Leap, who I hope is somewhere around here. Carolyn? There she is, who has led the NACHO profile. I hope you'll hear, and I'm not sure if Carolyn's planning to talk about it. I don't have much information other than I can tell you that they are doing some incredible work to make the tools available so that every practitioner can go on their website with this new thing called IQ Profile, and they could put in a question onto their website, and you can get the answers to, you know, what is the infrastructure of the local public health department around finance and organization. So they're still doing groundbreaking work. ASTO, you know, Paul Jarris has been an incredible partner, as is Jim Pearsall, and Katie Sellers, who I think is here. I thought I saw Katie, who's been the leader behind the ASTO profile. I mean, all of these players have played such a critical role in the field of public health services assistance research, and I have much to be grateful for and much to be humbled by, because they're still here 8 years later, committed to an area of research that in the very beginning got very little respect. But I think what you'll hear is that not only are we getting respect, but we're getting results, and people are starting to pay attention to what we're doing in public health. You know, again, the advisory committee members, as I mentioned, you know, folks far and wide have contributed to the success of this field. Glenn Mays, you know, I can't say enough about him and his leadership. You know, there was PHSR in Glenn's life before there was Quentin and Jasper in his life, his 2 sons. So, you know, I get, every time I see him, I ask him, how is it going at the coordinating center? And then I ask about his kids, because I feel like they belong to PHSSR. And, you know, then the sitting state health officers in the room, the local health officers in the room, you know, Paul Haverson, who's there from the very beginning in CDC when they developed the first research agenda, and they talked about performing standards. I mean, we have some incredible PHSSR rock stars in the house. And so I hope those of you who are junior in your careers, those up-and-comers, those aspiring PHSR researchers, get an opportunity to meet with a lot of these folks here. And I just, you know, I have formal comments, so these are just my thank yous, so you might want to get real comfortable. But I want to finally say that There are a lot of PHSSR grantees here. I saw Hector Rodriguez a few minutes ago. Hector was one of our early PHSR, I think, successes, first as a mini grantee, and then he went on to get a NNPHI PHSSR grant, and now getting incredible recognition from NIH, got a K award and working on R21s and all kinds of things. So, I mean, this is the kind of field that you all as junior investigators are going into. Dawn Jacobson over here and others who are just really doing incredible work, so you should get to know them. So, I prepared formal remarks because this might be the last time I get to do this. Maybe not. I said to Sketch he can invite me if I actually write an article on PHSSR because for so much time I've been behind the scenes. But James Baldwin once said that know whence you came, because if you know whence you came, there's no limit to where you can go. And this is a time for celebration because we come a really long way. In 2006, the Robert Wood Johnson Foundation established the public health team to drive fundamental change and improvements in the quality impact of public health. And since then, the foundation has had a strong commitment to making sure that whatever work was done with evidence playing a critical role. Whether it's in the work that we do in QI, accreditation, or advocacy, we were determined to make sure that we asked ourselves the toughest questions first. Indeed, the Robert Wood Johnson Foundation's commitment to a strong evidence base has been lauded by many and in the field of public health and elsewhere, and the need for evidence is no more critical than it is now. With the passage of ACA, public health again is being treated as kind of a late dinner guest, to a feast of many promises, only later to have $5 billion worth of scraps taken away by other more important priorities. Local health departments have lost 40,000 jobs. 50% of local health departments have cut at least one or more programs. And without evidence to make the case that the public's health will suffer because of these cuts, we can expect, sadly, more of the same. Prevention and public health are the pillars of our economy and our society. Indeed, the only way we can improve the nation's health and remain competitive is to have a strong public health system.